How do I know that my child is healthy from autism? Most children with autism are not diagnosed until after the age of 3 years, because parents do not pay attention to the early symptoms and signs that appear on the child. But how to distinguish a child with autism from a healthy child? Are there specific signs and symptoms? How do I know that my child is healthy from autism? Behavioral symptoms of autism spectrum disorder often appear early in a child's life, as many children show symptoms of autism at the age of 12 to 18 months, or even earlier, so you can notice any abnormal symptoms or signs that your child shows during this age period, such as running away from looking into your eyes or the eyes of others while playing with him or talking to him, or if he does not react when he hears his name. He doesn't point his finger at something he wants, i.e. he doesn't like to communicate with someone in order to ask for something. His playing skills are poor, not like his children's peers. He has problems with nonverbal communication. If your child does not suffer from the above symptoms, know that he is free of autism, so try to pay attention to your child's development, growth and behavior during the age period of 1 to 2 years. Tips to help you detect your child's autism early. As a parent of a child, you can discover your child's autism early, as you know your child more than anyone else, and you notice his behaviors and how he develops with age, and the following are the most prominent recommendations and tips that will help you discover your child's autism early. Monitor your child's growth and development, as autism includes a set of signs that indicate a delay in development, speech and walking, social and emotional development, and others. Take your child to regular pediatric appointments to monitor any problems or changes. Pay attention to the nature of your child's speech. For example, a child with autism may stop communicating with his parents and not reuse the language until he does not say words such as mom or dad. Pay attention to any changes that occur with your child during a game with others. If the child becomes disinterested in the toys that he previously enjoyed or does not interact with those he plays with, he is likely to have autism. What would you do if your child had autism? When you discover that your child has autism and the doctor confirms his diagnosis, you should do the following. Talk to your child's doctor and work with him or her to make appointment plans and reviews, and book several appointments for your child at a speech therapy clinic, occupational therapy, OT center, physical therapy, PT center, and autism centers that offer social or behavioral therapy. Educate yourself more about your child's illness, seek excuses for his behavior and help him develop, and encourage him to treat. Children with autism sometimes have problems with motor coordination that need to be addressed. Understand your child and when he is doing certain behaviors. For example, your child may make repetitive movements or shake his body when he feels a certain feeling or needs something. Try to understand his feelings and needs.